So we will be reporting the sepsis and infection prevention safety. So the objectives are define sepsis and infection prevention, identify nursing responsibilities in infection control, understand legal and ethical aspects of infection prevention, apply the nursing process to infection control, and learn from real-life examples and role-play to improve practices. So this presentation of ours explores the sepsis, infection prevention, and safety practices in healthcare settings, emphasizing the nursing responsibilities and the application of the nursing process. So, asepsis refers to being free from harmful microorganisms, while infection prevention plays a crucial role in ensuring the safety and quality in healthcare. Safety in nursing involves the following protocols to protect both patients and the healthcare workers. So, these practices are essential in all aspects of nursing care, so to maintain a safety environment.
So let's begin with the key concepts and definitions. So asepsis, it means being free from disease causing microorganisms. So these are two types of asepsis. The medical asepsis or clean technique. This helps to reduce the number and spread of pathogens. So the key concepts include hand hygiene. So hand hygiene is washing hands before and after patient contact. PPE or personal protective equipment. This is use gloves, masks, and gowns to avoid cross-contamination. Third is cleaning and disinfecting. Regular disinfection of care areas and equipment. And then, proper waste disposal. So this is from safe handling and disposal of contaminated materials. So third is surgical asepsis or sterile technique. So this aims to eliminate all microbes during procedure. Its key components are sterile instruments. These are the tools that must be properly sterilized. And then sterile fields. These are specific sterile areas for procedures. And lastly, no-touch technique. This prevents from contamination from non-sterile items.
For the infection prevention, the goal is to stop the spread of disease by applying strategies and protective measures. Key concepts is hand hygiene, fundamental to remove germs. PPE protects the wearer from infectious materials. Environment cleaning disinfects surfaces and tools. The sterilization and disinfection kills microorganisms in instruments, especially surgical ones. Isolation and precautions used based on infection type. For the safety, both patients and healthcare staff are protected from harm. Key concepts are patient safety culture. Everyone is committed to making safety a top priority. Error prevention using tools like checklists, avoid mistakes. Risk management, identifying and solving potential risks before they cause harm. Staff training and competency ensures healthcare workers are well-equipped and knowledgeable. Safe environment, clean, organized, and well-maintained surroundings to promote health and safety. For the importance of the topic in nursing care, prevents healthcare-associated infections that can harm patients, ensure better patient outcomes by reducing complications and speeding up recovery, protects healthcare workers from exposure to infectious disease, support quality, evidence-based care by following proven practices, reduce healthcare costs by avoiding extended hospital stays and treatments, and for the last, uphold professional and ethical standards expected in nursing.
Now for the nursing responsibilities, first is the hand hygiene. Follow WHO 5 moments for hand hygiene. Use alcohol-based rub or soap and water and do this for at least 20 seconds. Wear and dispose of PPE properly to avoid contamination. For example, wash hands and wear sterile gloves for wound care. Now for number 2, proper aseptic techniques. Use medical asepsis for general care. Use surgical asepsis for invasive procedures. Maintain sterile field and prevent contamination. For example, use sterile gloves and tools during catheter insertion. For number 3, maintain clean environment. Disinfect beds, tables, and equipments regularly. Dispose of biohazard waste safely, especially for the needles and for the dressings. Sterilize tools and monitor air or water systems. For example, disinfect ventilators in ICU.
Number 4, monitor for infection. Identify the patient at risk. Example, weak immunity, open wounds. And then next is watch for sign, fever, swelling, redness, and then drainage. Example, check the surgical wounds daily for infection. Number 5 is educate the patient and families. teach hand hygiene, cut etiquette, and safety waste disposal. Encourage not to sharing personal items. Example, showing the patient how to clean the hands and discharge dressing. Number six is apply aseptic practices during a procedure. Prepare a clean work area. Use only sterile tools and avoid contact with non-sterile items. Example, keep the sterile field intact while inserting catheter.
Legal and ethical consideration in asepsis and infection prevention. First is the patient safety is a legal duty. Nurses must follow hygiene and infection control laws. Neglecting this can lead to legal consequences. Example is the negligence. Number two, ethical duty to do no harm. Preventing infection reflects the nurse's duty to protect and care. All patients deserve fair and safe care. Number three, speak up for safety. Nurses must report unsafe practices or lack of supplies and then promotes honesty, accountability, and safety for all. When a nurse neglects the protocols, it can be considered negligence or which means failing to provide the standard of care that is expected in a professional setting. If a patient suffers from an infection due to a nurse's failure to follow proper aseptic techniques, the nurse and potentially the healthcare facility can be held legally responsible. This could lead to lawsuits, disciplinary actions, license suspensions, or even criminal charges. So, depending on the severity of the case. So when a nurse neglects the protocols, it can be considered negligence or which means failing to provide the standard of care that is expected in a professional setting. If a patient suffers from an infection due to a nurse's failure to follow proper aseptic techniques, the nurse and potentially the healthcare facility can be held legally responsible. This could lead to lawsuits, disciplinary actions, license suspensions, or even criminal charges. So, depending on the severity of the case. So, this culture of transparency and accountability is essential in healthcare. When nurses report problems, it helps the entire healthcare team identify risk and fix them before harm occurs. It also ensures that the workplace maintains high ethical standards and stays in compliance with legal guidelines. By advocating for safety, nurses not only protect their patient but also support their colleagues and contribute to a healthier, safer workplace. Picking up. So, moreover, ethics also demand justice and fairness in patient care. So, every patient, regardless of the background, age, or condition, has the right to receive safe, clean, and infection free care. So, a nurse's commitment to ethical practice involves upholding this right for every individual under their care. Ethical nursing practice goes beyond just following rules. It's about doing what is morally right, even in challenging circumstances. So, therefore, ensuring a sterile and safe environment is not only a professional obligation but a moral one. A nurse's dedication to preventing an infection is a direct reflection of their commitment to the well being, dignity, and safety of their patients.
legal and ethical issues in practice, first is informed consent. For legal, you should get the patient's permission before procedures. For ethical, you should respect their right to choose. And next is privacy and confidentiality. For legal, protected by privacy laws. And for ethical, keep patients' info private and secured. And next is the scope of practice. For legal, don't perform tasks outside your license. And for ethical, know your limits to avoid harm. And next is the accurate documentation. For legal, records must be complete and correct. For ethical, be honest and detailed in all charting. And then next is safe medication administration. For legal, errors can lead to malpractice. And for ethical, always check the right drug, dose, and time.
In mandatory reporting, nurses are legally required to report any signs of abuse or danger to patient safety. Ethically, this protects vulnerable individuals who can protect themselves, like children or elderly patients. In end-of-life care, legally, nurses must respect advanced directives like DNRs. Ethically, they must provide compassionate care and support the patient's choices at the end of life. In professional boundaries, it's illegal for nurses to engage in inappropriate relationships with patients. Ethically, maintaining boundaries builds trust and ensures a safe, respectful environment. In cultural and religious sensitivity, discrimination is unlawful. Ethically, nurses must honor patients' beliefs and practices and adapt care without judgment. Lastly, in delegating tasks, legally, nurses can only delegate to qualified staff. Ethically, they must ensure those tasks are done safely and responsibly, since the nurse is still accountable for patient care.
So that concludes our presentation. So as a group, we prepared this video to help you understand the key points and real-life application by giving you a real-life example, scenario, or role play to enhance the understanding and why this matters in our everyday lives and practice. So sit back, relax, and let's dive into the presentation. So we hope you enjoy and learn something new in this video.
Okay, let's get this IV placed quickly. Gloves on and needles ready.
Wait! Nurse Kai, stop right there!
Is there something wrong, ma'am?
Yes, you didn't perform hand hygiene, and the gloves you're using aren't sterile. Also, you haven't disinfected the insertion site. This could lead to a serious bloodstream infection. Infection prevention is part of our ethical and legal duty. Start with proper hand hygiene, use new sterile gloves, and thoroughly disinfect the IV site.
Understood, ma'am. Thank you for guiding me. So, procedure done. No swelling and redness. Thank you, ma'am, for teaching me. I've learned a lot.
You did well. Remember, patient safety always comes first.
So for our reflection and summary, our presentation emphasized the importance of asepsis, infection prevention, and safety in nursing care. We highlighted how proper techniques and safety protocols protect both patient and healthcare workers and how the nursing process supports effective infection control. Through this activity, we learned that even simple action like hand hygiene can significantly impact patient outcomes. We also deepened our understanding of the nursing roles, strengthening our teamwork and communication, also the critical thinking skills, and realized the value of being ethical, knowledgeable, and vigilant in nursing practice. So now, that concludes our presentation. We hope it gave you a valuable insight and help deepen your understanding of the topic. So thank you for watching and taking time to learn with us. So before we end, here are the references we use to support the information in this video. So, we encourage you to explore these sources if you like to learn more. So, once again, thank you and stay informed and inspired.